wellness revolution starts now.
Welcome to the program. One of the most common questions I get is, what is the right dosage form for my hormones? And if this was a yes or no answer, we would not be having a whole episode on it. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And today we are going to talk about dosage forms. As you can see, if you're watching, I have several in front of me, and we're going to go through each one of them one by one, because this is something I have never talked about on a podcast before, but I really think it needs to be addressed because we get questions about it all the time at the pharmacy. So first of all, as a compounding pharmacist, and all of our compounding pharmacists at Physicians Preference, one of the main questions we get is regarding dosage forms. Sometimes we get calls from guests saying, well, I used to be on the cream. Now I'm being recommended a sublingual tablet. I used to take the oral capsule many years ago. Which one is better? Which one can I go back to my doctor and tell them is better? Well, it's not a cut and dry answer, which again is why we're having this conversation today. So I want to start by unpacking some definitions, actually. We're going to be having a conversation around doses, dosage forms, routes of administration. And so I want you to get familiar with this verbiage so you can understand what I'm talking about and have a good educated conversation with your physician about it. That way it gives you more flexibility in tailoring and personalizing your dosage form so that it fully fits your lifestyle, which is also going to complement and support your adherence or compliance to the program. Compliance equals success, and of course we want you to succeed on your health and wellness path. So we'll start by defining what an API is. So in compounding pharmacy, we receive a prescription from your doctor that says, for example, make a low-dose naltrexone capsule. Okay, low-dose naltrexone is the API. It's the active pharmaceutical ingredient. So that's what they write the prescription for. But it's not just as simple as taking the low-dose naltrexone powder that we get from our supplier and sticking it into a capsule. I wish it was, but this is actually the fun part, is we get to curate the formulation so that it is tailored to you. So we be sure that we put fillers in there that support consistent mixing of your API or your active pharmaceutical ingredient. Also, if we need to slow down how fast that medication is released in your body so that you get the max benefit, we can put slower release ingredients inside to be sure that it meets those requirements. Also, if we're addressing a dermatological issue, of course, we want to be applying it to the skin. Anytime that we can apply the medication directly to the area of concern, we will always have a better outcome. Not just because we're putting it where it needs to go, because that seems pretty logical, but we will also have lesser side effects because we're being more precise and more intentional with where we're putting that medication. So we're always very curious about what is the patient trying to treat, where do we want the medication to go, and that helps us select or work with your physician to select and tailor the right API or active pharmaceutical ingredient to you. Second, dose. So this seems pretty straightforward, but what is my dose? So the dose is the amount of medication that you're taking at any given sitting. So if you're taking it before meals and you eat 3 meals a day, and then you're getting X amount of milligrams, that's your dose prior to each meal that you're taking. And that's what the doctor prescribes for you. So when we receive a prescription, they're very tailored about the dose and also the route of administration. So what about the dosage form? So I mentioned dermatological, for example. As you can see, I've got some creams here as well. I've got topical solutions intended for the scalp, nasal spray, sublingual tablet, which goes under the tongue, and then different cream formulations. So we want to be sure that the drug, the active drug, the API, is getting to where it needs to go. We don't just want to administer everything orally through capsule or tablet form, because we may get some unintended side effects. Or if you get that systemic absorption throughout the whole body, but you're trying to address vaginal atrophy, let's say, then really what's the point of that? We want to put it where it needs to go. So that leads me to route of administration. If we are trying to address a dermatological issue, we want to apply it to the area that is affected. Let's say for eczema or psoriasis, for example, we want to apply that cream directly to the affected area. That way we can apply a minimal amount, and therefore, again, we get minimal side effects. So first pass metabolism is something that maybe we don't directly talk to a lot of our guests about, but that's some behind the scenes conversation we have with prescribers, is how is the terrain of the guest's gut How diverse is your microbiome? Is it healthy enough to be fighting off toxins and just holding on to the nutrients so that you can appropriately convert the drug that you're taking to the active form? But not only that you can also absorb it as well. So one primary example that I'll use, because most of the guests at the Hotze Health and Wellness Center are taking thyroid or have or will at some point, because it's one of our specialties here, is that if you take T4, for example, the inactive form, there is some conversion that takes place in the gut to the active form of thyroid hormone, which is T3. So if you have come in and you get a prescription for thyroid, but you're completely neglecting healing your gut, you're really wasting a large portion of your money by even getting that prescription, because you're not getting the most bang for your buck. But it's not always just that straightforward. There's always more things that are complex going on in the body that we have to consider when we think about dosage form. So for example, and I'm going to go through each of these, but these sublingual tablets, for example, this is a dosage form that we customize here at Physician's Preference Pharmacy. And this is a tablet, not an oral tablet. It's a sublingual tablet that dissolves underneath the tongue. So if you have poor gut health, I'm not doing you a very good service as a pharmacist by telling you to swallow medication that you can't absorb. So that's one example of when we use something like a sublingual tablet that dissolves under the tongue, because it bypasses that first pass metabolism. So when you swallow an oral capsule or tablet, the most generic dosage form and generally the most inexpensive, it's going down your throat into your stomach, into the GI tract. So it's going through the small intestine, the large intestine, and then it gets pulled out into the intestinal blood. Then it goes into the liver, where the majority of medications, foods, toxins, alcohol, all these things that we know are metabolized by the liver. We actually can get some benefits by some medications passing to the liver because it benefits the liver as it passes through. But most of the metabolism or breakdown of those medications actually happens in the liver. That's the first pass of metabolism. Then it spits it out into systemic circulation, which is your bloodstream. So there's actually a lot that happens before that medication goes into your bloodstream and is even available to your body to be used. So if you have poor gut health and we need to circumvent or avoid first pass metabolism, then we want to choose something like a sublingual tablet. So this is one of those examples. Now that brings me to the topic of bioavailability. I'm getting to use a lot of fun words in this episode. So bioavailability is basically how much of any medication that you use, your body is actually absorbing and using. So you may say, well, I take a 4.5 milligram low dose naltrexone prescription. Your body is in no way getting anywhere close to utilizing 4.5 milligrams. It is exceptionally lower than that because as an oral capsule, again, you got to go through all the first pass metabolism through the liver before it gets spit out into systemic circulation. One thing I really want to point out here is that when we consider bioavailability correctly, which is a large part of what we have to do as pharmacists. This is called pharmacokinetics. We have to know where that medication is going and where it's getting distributed in the body. When we consider that bioavailability or how much you're actually absorbing correctly, this is when we can actually optimize your dosage form. This is why we are part of your healthcare team and we work with you and your healthcare prescriber, your doctor, your physician, to help customize and tailor the dosage form. This increases efficacy and decreases side effects. And that is really actually a big part of our responsibility as compounding pharmacists. So I'm going to go through a couple of our dosage forms here and also give you an idea or some insight on some of the bioavailabilities associated with these different types of dosage forms. So the most simple example to illustrate bioavailability is an IV injection or infusion. So when you're hooked up to an IV bag and you've already had the needle inserted directly into your vein, that is 100% bioavailability because it is 100% absorbed into the bloodstream immediately. So that is the most dramatic example of high bioavailability. Now, one of the benefits is you get 100% absorption. One of the less beneficial things about an injection or IV is it requires needle insertion or an injection which a lot of people do not prefer. Also, we have other types of injections. So sub-Q, which just goes underneath the skin, or we even have intramuscular as well. You might be familiar with some of these if you've been doing testosterone shots, for example. All right, so we talked a little bit about sublingual tablets. That's the first one I want to talk about. When you do dissolve one of these tablets underneath the tongue, which, by the way, these are probably my favorite dosage form that we have, and I take several of our prescriptions, including our methylated B vitamins, in this formulation because they dissolve very quickly and they're very easy. You're getting somewhere around, if you're taking hormones in this sublingual tablet form, about 50 to 70%. So let's say that you're taking a 2 milligram sublingual testosterone under the tongue. You're maybe getting a milligram, 1.5 milligrams, something like that. Some of the benefits of this sublingual tablet is it's an easy dosage form to use. You just pop it underneath the tongue and away you go. So it has a higher bioavailability when compared to some of the other dosage forms. It also utilizes some very important real estate in the mouth. So underneath the tongue, you have large vessels that are the gateway directly into systemic absorption or into the bloodstream. And again, that's really important because we can utilize that for complete absorption, but you have to be sure that you're using it right. And that's one of the potential disadvantages if either you're not using it like you're supposed to, or maybe you're confused about how to use it. And actually, this is a pretty common concern when folks call in and they say, well, my XYZ medication in sublingual tablet form isn't working. Okay, well, tell me how you're using it. Well, I just put one in my mouth in the morning and I swallow it. Okay, well, that's not how it's supposed to be used. Part of the problem about that is that these, if they are swallowed and they go through the stomach, they're going to be broken down by that hydrochloric acid that should be breaking down capsules and other formulations, or maybe some medications, they even need to be, you've probably heard of enteric coated. That is a coating that you'll see over certain medications, even over the counter like ibuprofen or things like this, that help to protect that medication from that stomach acid and just being destroyed. That way it travels to where it needs to go in the body. Very, very important with sublingual dosage formulations. Most of our guests take oral capsules as well. So just as an example, when you wake up in the morning, if you have medications that need to be taken on an empty stomach, you need to take those capsules first. They get swallowed with a large glass of water, and then you always finish out with the sublingual tablet, because when it's dissolving in the mouth, it's going to take a few minutes to dissolve fully. And if you use these before, then you'll know what I'm talking about. But when you place it under the tongue, your body thinks you're starting to digest something. So you start to create or release some of these enzymes like salivary amylase to break down that dosage form that has just been placed underneath the tongue. So it sort of puffs up as it's absorbing your saliva, and that helps to break down the medication. It gets fully absorbed very quickly, but I always tell people when I'm counseling them, after you've used a sublingual dosage form, you have to wait 15 minutes before you take anything by mouth. That includes food, drinks, coffee, even water. Nothing by mouth. The reason why is the whole point of this dosage form is to circumvent that first pass metabolism. So the second you start swallowing the ingredients in here, you're already losing a major part of the efficacy of this dosage form and the whole reason why we use it in the first place. So just to make it very simple, capsules and then tablets. Capsule starts with a C, tablet starts with a T. C comes before T. That's how I always tell people to remember it. Once you get in that habit, it's really very easy to follow. Again, one of my very favorite dosage forms here. All right. Also, oral hormones. I don't have an oral capsule here because you know exactly what that looks like. But for our hormones that are prepared in the oral capsule formulation, you'll notice that many of those are in a slower release formulation, which means that we put a filler in there to slow down how fast that medication is released from the capsule into your body. So depending on the medication and the formulation, it's getting released in your body somewhere between probably 6 to 9 hours. So you're not going to have such a quick on-off effect. And in many cases, we actually really want to use that to our advantage. So another great dosage form. Your oral hormones probably have somewhere closer to about 5 to 10% bioavailability, so much less than what we just talked about with sublingual, which was closer to 50 or 70%. Topical hormones. So we work with physicians all over the country at Physicians Preference Pharmacy, and the preference for dosing hormones spans far and wide. I can tell you that right now. I have some physicians who will only prescribe hormones in the topical formulation. Others will only prescribe it in the sublingual formulation. Others will only prescribe it oral. It just depends on the prescriber specifically, which is why we're talking about this so that you can have an educated discussion with your physician and you're not just getting any old prescription sent to the pharmacy. So a couple of really important things about topical hormones. This device is called the TopiClick, and you'll see it at many pharmacies that are compounding pharmacies that you're getting this cream dispensed in. You're getting roughly 40% absorption with this guy right here. So again, common pitfalls or mistakes I see when people are not responding well to topical hormone therapy is they're not using the device correctly. We always welcome your questions to call us and say, hey, did you change something about the formulation? I was doing well, now I'm not. Of course, we want to have that transparent conversation with you. But this dosage form in this type of device is very accurate, and I'll show you how we use it here. So when you first receive the device, you'll need to prime it. So you'll need to be sure that with a click, you're at least getting out some cream, essentially. But let's just say that your dose is 2 clicks applied topically every day. So you would want to be sure that this is clean. You give your 1, 2, you can hear that audible click. And then you need to take this, do not wipe. I repeat, do not wipe. You want to take this and you want to apply it directly to the area. And so for many folks, we need to use the inside of the arm here. So what we're doing is we're actually applying it directly to the area right here to be sure that we're getting complete absorption where the area starts to feel warm. We can see that the cream is beginning to disappear and that we're getting some absorption there. So that's a lot of cream for that area. But I just want to illustrate exactly what we're doing there. Additionally, we want to be sure that after we use something like this and all the cream is off of it and it's fully absorbed into our skin, that we're not coming in contact with our partners, with our pets, with our children, or other pets or children or just other people, because we can be transferring that hormone to them. And we really do not want that because, especially just as an example, we don't want a woman to be exposed to male levels of testosterone. So that's a topical formulation. Then we also have some other options like the vaginal TopiClick. So again, you still need to prime this when you receive it, and that you want to be sure that you're getting the cream out. And once it starts to come out, then you'll use the device that has been provided with it, which is the applicator. So this is a vaginal applicator, and it actually is meant to come apart like this. This is to be reused over the course of 1 month. So for every tube that you receive, you should get one of these. And so if you need to rinse it, you can just pull these apart, rinse it with soap and warm water, and let it set aside and reuse it the next day. Once you have clicked, you'll go ahead and adapt it here. Clicks on as such, and then you'll click your dose up into it, like so. So let's say that it's 3 clicks, that's your dose, boom. And then you insert this much like you would a tampon, actually. So that's for your vaginal application. Again, if we want to address vaginal symptoms only, this is the great formulation to use. If we have this and systemic issues going on, we may choose a different route of administration. And that's why the route of administration is so important. And additionally, this would be an option we've talked about before, the hair support. The hair support solution is something that comes in a topical solution. So you go ahead and you draw it up as such, apply it directly to the scalp, to the areas that are being affected, rub it in lightly with the fingertips. And this is an example where you do not get systemic absorption. It is only intended, if we're talking about our hair support solution for the scalp for hair regrowth, to saturate the follicle, to nourish the follicle, to bring blood flow to the follicle and nutrients to the follicle and decrease inflammation at the follicle, not to be absorbed through the head, through the scalp, or into the body at all. So you probably have zero bioavailability there as far as systemic circulation. We have talked about in the past, we have a separate podcast on pellet therapy with myself and our pharmacist in charge, Kim Bennett, and we'll go ahead and link that one too. That's another one that covers the bioavailability and absorption of hormones. We are not proponents of pellet therapy because it is what we refer to as supraphysiologic dosing, which means that the dose is much, much, much higher than what your body would naturally make, which is why it can be inserted and left under the skin for several weeks before you need a replacement. So for that hormone in that pellet to be driven out into the bloodstream and into the tissues, it needs to be at a very high dose so that it can exit the pellet and release. So that's why we are not fans of that. I know many people feel really good when they first get on pellet therapy. We've also had women tell us that they're growing chest hair. And obviously it seems like a joke, but it's not, because we actually hear it pretty frequently. So we want to be sure we're getting the dose right. We want to be sure we're getting the dosage form right. And we want to be sure we're getting the API, the active pharmaceutical ingredient, correctly. So again, when we optimize the dosage form and the route of administration, what are we doing? We are decreasing the chance of side effects, and we are increasing the efficacy of that product, which is why it's absolutely crucial that you find a physician that understands this, that is either open to prescribing compounded prescriptions, familiar with it, or we'll have a conversation with your pharmacist about it, because this is what we do each and every day. We love being problem solvers, and we love thinking outside the box to help you feel your best. So certainly, if you have any questions about any of these dosage forms or other dosage forms that you may be on, because this certainly is not all inclusive, please do give us a call at Physician's Preference Pharmacy at 281-828-9088, and it would certainly be our privilege to serve you. Did you know that pharmacists are considered the most accessible healthcare professionals, and yet at the same time, we are generally the most underutilized? Pharmacists are medication experts, which means that we can best advise you on the safe and appropriate use of your medications, when to take them and how to take them. We're experts in pharmacology, which means that we receive extensive training to understand the science behind how medications work within the body. We screen for any interactions which may occur between the medications you're taking, and we have an in-depth understanding of how these medications affect each system of the body. Your body is unique, which means that the type and dose of medication you take should also be unique. We want you to know that at Physician's Preference Pharmacy, we are always available to you, and we welcome your questions.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.